Popular weight loss drugs like GLP-1 injections and shots are helping millions of people shed pounds. But a new study shows that stopping these medications can cause the weight to rapidly come back and even reverse positive health effects. The research published in peer-reviewed medical journal, the BMJ, finds the average rate of weight regain after stopping treatment is around 1 pound per month. This can lead to people returning to their baseline weight in less than 2 years. And the study also found improvements in blood pressure, cholesterol, and fasting glucose are reversed less than 1.5 years after stopping treatment. CBS News medical contributor Dr. Céline Gounder joins us now. She's also an editor-at-large for public health at KFF News. I also think that it's alarming that it can come back even faster than not by using GLP-1s, just by using traditional diet and exercise, right? I mean, how does this tell us about how we're treating obesity and these conditions?
Yeah, in fact, the weight is regained 4 times faster.
4 times
with
faster.
GLP-1s is the way you're losing weight versus the more traditional diet and exercise. So it's a significant difference. I think, first of all, losing weight by itself is not necessarily a reliable indicator of health outcomes like how long you're going to live. Are you going to have a heart attack? And secondly, I think the over-focus on weight versus health by our medical system has backfired in some ways. It's fueled stigma, and it, in some cases, has harmed care for patients.
And so if weight loss shouldn't be the only yardstick, what should be?
Right. So when you look at clinical trials of GLP-1 drugs, as well as other more traditional approaches to losing weight, the weight loss sometimes translates to improved biomarkers, so like your glucose, your cholesterol, maybe better blood pressure. Not always, though. And sometimes you see patients regain weight, but those markers remain good. In other cases, people because they're centering weight too much, they are not focusing on perhaps some of the other things that they need to be doing to improve their health. So that might be the quality of the food that they're eating, and so on.
There's so much we don't know about GLP-1s and long term. Do we know why this is happening?
Well, and I'm not going to say this is everybody, but many of the people who are taking GLP-1 drugs are not doing some of the lifestyle behavioral modifications that really would promote better health. So, of course, that's the old diet and exercise. And so these drugs are not a get out of jail free card. You still have to make those changes in your life. Now, think of the GLP-1 drugs as a jumpstart to that change, but you still have to do the other things if you want the health benefits.
Dr. Céline Gounder, thank you.